Hi everybody, welcome back to my channel. So for this week's video, I wanted to discuss the different types of surgery, the different options that are available for weight loss surgery, the most common three, when you are going, of course, like I said, for bariatric surgery. So the three that my program and my doctors discussed with me were the gastric bypass, also known as the Roux-en-Y or RNY, the gastric sleeve, and then the duodenal switch. So those are the three that I was discussed about with my doctors. And then from there, I could ask questions and choose which one with my doctor that would work best for me. I personally chose the RNY, the gastric bypass, because overall, that one is the one that is best for me. Now each has their benefits, each has their drawbacks. So I'm not personally going to say which one's best, which one would be best over the other ones. This is me presenting the information that I have of the three most common ones that are offered. So the first one I'm going to talk about is the gastric sleeve. The other name that you might hear it as is the vertical sleeve gastrectomy. Now, essentially, what the doctor, the surgeon, is doing is essentially just lessening the capacity of your stomach. So going from what you would normally think of a stomach, they would then turn it into something that represents more of like a tube or a banana. And it's one of the more popular ones because you're really not changing anything about the anatomy. You're really not changing any connection of like the esophagus and the intestinal tract. You're really just, from my understanding, changing the size of the stomach. As, like I said, it's becoming the most popular one because of it maintains the normal anatomy, as well as there's generally fewer complications with it. And I'm going to read a couple things that has the list of like issues, side effects that could happen, complications that could happen post-surgery with the gastric sleeve. Now, gastric sleeve, for kind of a point of reference, for somebody that is 100 pounds overweight, with the gastric sleeve, on average, they'll lose 50 to 60 pounds. To kind of put it in perspective of how much weight you would lose with this. So some of the risk factors for the gastric sleeve are breathing problems, pneumonia, infection, bleeding at the incision sites, blockage of the GI tract, leaks at the site where the stomach and intestines are sewn together, blood clots in the leg, blood clots in the lung that can cause chest pain or trouble breathing. And other risks are leaks at the staple line, where they're bringing the stomach together to make it smaller, narrowing of the stomach, esophagus, or intestines, which is known as a stricture, just where it's becoming excessively tight, excessively narrow. Injury to other organs, which is entirely possible, heartburn, and ulcers along your GI tract. So for the Roux-en-Y surgery, or the gastric bypass, you might hear it as both. This one is probably the most popular of the three that I'm going to talk about today. And there's a very good reason why. Mainly because it severely limits the amount of food that you're able to intake at a time. All three of them do that, but this one does it to a kind of a better proportion from my understanding. So what the surgeon is doing is essentially stapling off a section of your stomach to make a new sort of pouch stomach that holds about 1 to 2 ounces of food or liquid at any given time. And then the outlet of the pouch empties directly into a lower portion of your intestine. Welcome to my cat. She is adorable. And that does reduce the amount of caloric intake and absorption of nutrients that your body's able to work with. And for kind of the 100-pound overweight comparison, so if you're 100 pounds overweight with a gastric bypass, you'll lose roughly 60 to 70 pounds. And of course, exacerbate that a little bit. So say you're 200 pounds overweight, it would be comparable to more like 120 to 130-ish. And that's going to, of course, depend on the person. Now, there's a little bit more to just stapling off the stomach and attaching the end of it to a part of your intestine. They don't take out the section of stomach that they staple off. They actually will staple that closed, leave it in your system, and then they'll kind of, so say this is your intestine and my fist is your stomach. They'll separate it, and then they'll take this part of the intestine, hook it up to the new stomach, and they'll reattach this part of the intestine and the original pouch of stomach lower down, because the new pouch of stomach will not create stomach acid on its own. And the lower section of intestine that's attached to the new stomach is not connected to the liver, where you'll get the bile. And so they need to make that connection lower so that your body is still able to get the bile to break down fat and get the stomach acid to help break down proteins and carbs further. But they just have to, in a matter of speaking, get creative with how they do it. So some of the risks of the Roux-en-Y surgery, the gastric bypass, are breathing problems, pneumonia, infection, bleeding at the incision site, blockage in the GI tract, leaks at the site where the stomach and intestines are sewn together, blood clots in the legs or in the chest, which of course can cause pain, breathing problems, movement problems, leaks at the staple line, narrowing of the new stomach or esophagus area, or where the new stomach meets the intestines, which is called a stricture, lower mineral and vitamin absorption, ulcers, especially if you are a smoker or if you frequently take NSAIDs after surgery, low blood sugar, even if you don't have diabetes, and low blood sugar is called hypoglycemia, anemia from low iron absorption, trouble accessing the lower part of the stomach and the duodenum. The duodenum would be the first part of the small intestine. Dumping syndrome, which I will talk about later. Gallstones, hernias, malnutrition, and a stomach perforation. So for the duodenal switch, this one is actually a little more complicated than the gastric bypass and the gastric sleeve. So I'm actually going to read the information that I have to be able to accurately describe what's actually going on with the switch. So duodenal switch is also called a bilipancreatic diversion with a duodenal switch, but most doctors will just call it the duodenal switch. And so there's a couple steps to the surgery. The first step is the sleeve gastrectomy, where roughly 80% of the stomach is removed, leaving a tube-shaped stomach. It's similar looking to a banana. And the valve that releases the food into the intestine is called the pyloric valve. That will remain. Whereas, say, in the gastric sleeve, that doesn't remain, from my understanding. And as well as a limited portion of the small intestine that normally connects to the stomach. So, the lower portion of the stomach, where your stomach connects to the small intestine, that will all remain there. And then, since the stomach is made smaller, that will now be connected to the esophagus. And then the second step of it is the bypasses of majority of the intestine. So the duodenum is then, which is the first section of the small intestine, is now going to be connected more towards the ileum, which is the latter part of the small intestine, the lower portion of the small intestine. So those are being connected now. The middle section is being skipped, essentially. And so for the duodenal switch, that doing both steps essentially creates it limits how much you can eat, and it reduces the absorption of both proteins and fats. And this is used for people that are much more severe cases of obesity. It's not used for everybody with severe cases of obesity, but it may be suggested more for people that are much higher weights. I'm not a doctor, so I'm not going to say it's always, but it may be suggested with more emphasis. So because the duodenal switch has the 2 stages of the surgery, there are a few more risks and concerns. So I am going to read them off of my sheet, my little info sheet that I have. So risk factors, which are, some of them are similar to the Roux-en-Y and the gastric sleeve. If you haven't noticed, a lot of them are very similar. Excessive bleeding, infection, adverse reaction to the anesthesia, blood clots, again in the legs or the chest area, lung or breathing problems, leaks in the GI tract, bowel obstructions, dumping syndrome, gallstones, hernias, low blood sugar, even without diabetes. Again, that's called hypoglycemia. Malnutrition, stomach perforations, stomach ulcers, and vomiting. So dumping syndrome, I mentioned that I had wanted to talk about it while I pet my cat because she is adorable. Dumping syndrome is essentially where after you have weight loss surgery of some sort, the food and beverages that you are intaking are moving through your system way too quickly. One of the big causes of it is if you are eating too quickly, or you are drinking too closely to when you're eating. Dietitians and surgeons all recommend do not drink 30 minutes before to 30 minutes after you're done eating. So if you're planning on eating at, say, noon, stop drinking at about 11:30, and then say you finish eating at about 12:30, 12:40. If you finish at 12:40, you're not drinking until about 1:10 in the afternoon, to help prevent dumping syndrome, because dumping syndrome will really cause diarrhea. In many cases, it will cause people to have rapid heart rate. You kind of break out in cold sweats, from what I've heard. I have not had surgery yet, so I have not experienced it. Cold sweats, from what I've been told, you kind of feel panicky. Not like a panic attack, but, that sort of like anxiety, panicky sort of feeling. It can cause some vomiting, but more than likely you're going to have some diarrhea, which is the biggest reason that your doctors and your dietitians are going to tell you when they're going over all of this information to make sure that you are taking your time to eat everything, and that you make sure that you're not drinking too closely to your meal beforehand, and you're not drinking too quickly after your meal. And of course, weight loss surgery is not for everybody, because people do have very good success with just changing their diet and adding exercise into their lifestyle. And some people may have it where, they were similar to me, where they tried the diet and exercise. That was not really effective for them, but the addition of medication worked for them. That really helped them. And then there's people that are like me, where both of those options really didn't work. You've made the lifestyle changes of eating healthier, like consciously eating healthier, consciously making sure that you're exercising every day or almost every day, up to about 2.5, 3 hours a week, and they're just not seeing the results. And so weight loss surgery is going to be the best option for them. And then there's also people who struggle with their weight, that are not willing to change their lifestyle, which is very unfortunate. It does happen. And so they don't qualify for this sort of stuff. So they have to, because they're not willing to change their lifestyle, for whatever reason, there's a variety of reasons why that may happen, they're not able to lose the weight and get healthier. So like I said, this is just the best option for me. And going through the process, I want to help educate people on like the options of, if they're in the same boat as me, there's options. There's ways to move forward and become healthier when you have already started getting those healthier habits. Like I said, eating well, exercising, getting your mental health under control, mental health and emotional health. When you have all of that and you're working on that to be healthier overall, but the weight isn't showing it, there are options for you to be able to get better. If anybody has any questions on anything or where I got my information, let me know down in the comments, and I will see you guys later.